Good morning.
Good morning, sir.
Good morning, sir.
Well, let us continue from the with the next class, the previous class. So we were discussing regarding the stability testing, and we have discussed regarding some of the guidelines, the very important or the essential guidelines which are required for the stability testing of the pharmaceuticals. So these guidelines are very much essential as the stability testing is just one of the parameter to say that any product is being sterilized, because it also includes, apart from the sterility testing, it also includes the GMP what is followed and the validation of the method and the selection of the method. So including all, so this the product will be released based on this the report of the sterility testing. And as per the pharmacopoeia, there are many pharmacopoeias. So there are two methods have been given from the pharmacopoeias. One is called as the membrane filtration technique, so which is a preferred method if we can filter the product by any way. And if we cannot filter the product, so then we are going to use the direct inoculation method, which is an alternative method. So these are the two methods commonly used for the sterility testing. So this test, it was first introduced in the year 1932 in British Pharmacopoeia, and as a direct inoculation test in the beginning. And it was followed by the United States Pharmacopoeia in the year 1935. But later in 1957, the membrane filtration version was introduced. So since then, both the methods are official in almost all the pharmacopoeias. The preferred method is the membrane filtration method. Whenever it is not possible to filter any of the products, so then we go for the direct inoculation technique. So we'll begin with the membrane filtration technique. So here the membrane filtration method, it is gained and maintained its glorious tradition recognition to not only circumvent but also to overcome the activity of the antibiotics, for which there exists practically little inactivating agents. So that means when we are going for testing a pharmaceuticals for the sterility testing, most of the time the product will be containing certain chemicals which are having inhibitory effect on the growth of the organisms, either in the form of the preservatives, or the main pharmaceutical or the main drug itself is having an antibacterial property. Either that could be an the bacteriostatic or a bactericidal in nature. Especially, it's going to be a major problem when it is a bacteriostatic product, or the product is bacteriostatic in nature. Because what happens when the product contains the bacteriostatic itself and it is subjected for the sterilization, and if any microorganisms which have retained or which have not killed during the sterilization process. So when you perform this the sterility testing, all of the chances is that whatever the remaining microorganisms, because these organisms will be very small in number, very less, and also they will be very weak because of the exposure to the sterilization process, and also the presence of certain antibacterial or antimicrobial products in the antimicrobial agents in the product, so that will completely inhibit the growth of these organisms. In such case, we may get, most of the time, we may get the negative or the false negative report. So that means the product might have been, the report may say that the product passes the sterility test, but in fact, there could be possibility of some microorganisms which have been still alive, or the live microorganisms present in the product. So that is the reason this filtration technique, it will avoid such product which are bacteriostatic in nature, because we are going to filter the product, and we may even rinse it with the sterile water or any inactivating agents. And then, so because of that, on the filter paper, there could be only microorganisms, so either the live or dead organisms will be present. So there is no effect of this antimicrobial agents in the during the sterility testing. So that is the reason this membrane filtration technique is invariably, it has been given preference in the pharmacopoeia. Otherwise, unless otherwise it is mentioned, or otherwise the product is not filterable. A method is very simple. So the method, it emphatically, it requires the certain characteristic features. One is an exceptional skill. That means the person who is performing this membrane filtration technique for the sterility testing, he should be highly skilled and he should be highly knowledgeable, and he should have an in-depth specific knowledge about the test, what is performing, and also the consequences of the false reports. And rigorous routine use of the positive and negative controls is very much essential, because either it's a membrane filtration technique or the direct inoculation technique. So definitely the use of the positive and negative controls is very much important. So we'll come to that, what are the positive and negative controls in the later stage. So procedure is very simple. So the membrane filtration or previously sterilized the unit is taken, and membrane is inserted in the filtration unit, and the substance or the product is filtered either by using the negative pressure technique or by using the positive pressure technique. It is filtered, and then the filter paper membrane filter which is used for this filtration is taken out, and it is placed in the all the previously sterilized inoculation media, and then it is allowed to grow, and the presence of the growth, absence of the growth will give the result regarding the positive or negative report on the sterility testing. So how it is performed? So as I already told you, the solution of the product under investigation, it is carefully filtered via hydrophobic edged membrane. That means the edge of the filter paper will be having a hydrophobic material so that there will not be any sticking of any material in the edges.